Hello everyone, my name is Gaurav Memi and we're going to be talking about strokes. Now before we begin, I want you to imagine something. I want you to imagine that you are having dinner with your mom and out of nowhere your mom drops her fork. And then when you look at her, you start noticing something. You start noticing that the left side of her face or the right side of her face is drooping. And then you start noticing when your mom is trying to talk, she's slurring her words. She's having a hard time expressing what's happening to her. She might even be confused or disoriented. Would you be able to recognize what's happening? So, according to Majinder, who is a publisher, and in 2024, she discovered that strokes are the leading cause of disabilities worldwide. And strokes are something that a lot of people do not have knowledge on, and it is something that needs to be treated immediately. And today we're going to be discussing what strokes are, what are some warning signs of a stroke using the GFAST method, and why immediate transport to a nearest stroke center is important. So before we begin, a stroke, what is it? So there's two types of strokes. You can have an ischemic stroke or a hemorrhagic stroke. An ischemic stroke is when there is a clot dislodged in your brain somewhere, which is causing a lack of blood flow. And that lack of blood flow starts to slowly kill your brain tissues or brain cells. On the other hand, you can have a hemorrhagic stroke, and hemorrhagic strokes is a rupture in a vessel which causes that lack of blood flow. Now, according to Laura and Anna, who are two neurologists, in 2023, they found that 80% of the time, ischemic strokes are what most people suffer from. And ischemic strokes are also easier to treat over hemorrhagic strokes. So now that we know what a stroke is, we can move on and figure out how you can find the how you can read signs of a stroke. So we're going to use the GFAST method. And this method has been proven very beneficial by Kai Wei Lin, who is a researcher. And in 2023, he found that people who use the GFAST method actually were able to get transported to hospitals quicker and receive treatment quicker. So first of all, the G in GFAST stands for gaze. So you want to look at if their eyes are unequal and or dilated. And then the F stands for facial droop. A stands for arm drift. They might have unequal grips. S stands for slurred speech, and T stands for time. And we have to remember time is tissue in these situations, and you want to get patients who have any of those symptoms to the nearest stroke center as soon as possible. And the reason why we want to get them to the nearest stroke center is because of this medicine called TPA. TPA is a basically like a clot buster. It will go into your brain and it will find the clot and it will destroy it so that blood flow can continue, and it might be able to salvage some of the tissues that have been injured but not killed, and this will lead to a person not having long-term deficits. So with that in mind, now that you know what a stroke is and how you can see it, I hope that in the future, if you ever run into a situation like this, you are more equipped in finding out what's happening.